So urologists treat any of the organs involving the genitourinary tract. So starting at the kidneys, down to the ureter, the bladder, the urethra, the prostate, the penis, the testicles. Those are all our sort of real estate. And a lot of what we treat is involving cancer involving any of these organs. But there's a number of benign conditions as well that involve G organs. COVID hasn't had a direct impact on G illness per se, but like any other area of medicine, it's had problems in terms of patients seeking their care for fear of COVID. So in my practice, I had a real problem with patients following up in the clinic, seeking help when they're having pain from kidney stones, when they're having recurrent urinary tract infections, when they're having difficulty urinating. I've had issues with patients that haven't undergone their routine surveillance for known urologic cancers and missing those appointments. And we've also had issues with delays in getting patients to the operating room because there's been limits on going to the OR for elective cases. One of the positive aspects of the pandemic, we've really made an effort to implement telehealth, and I would say about 30% of my patients now, I conduct telehealth visits instead of in-person office visits, and it's very convenient. Patients sometimes prefer that, and it's safe. For the patients who need to be seen in the office or the patients who prefer face-to-face visits, it's also much safer. The staff is just about fully vaccinated, and we have protocols in place to limit patient contact as well. And finally, in terms of going to the operating room, there's a very robust system of testing in place to minimize any chances of catching COVID during operative procedures. If you're having any problems urinating, especially if it's persistent, yes, you should see a urologist. We're trained to sort of diagnose and treat the variety of problems that you can have urinating. So this can be issues with weak stream, with straining, with getting up at night, with urgency, with frequency, with leaking urine, with burning with urination. There's a real spectrum of problems that can be involved, and what we are trained to do is diagnose and treat it the most appropriately. If you're having frequent urination, you first have to determine, is it a bothersome problem for you? A lot of people are very gung-ho about drinking more and more fluids these days, and the more fluid that you drink, the more frequently you're going to urinate. If it's not causing a problem for you and that's just part of your lifestyle, then it's not a problem. But if it is bothersome, if you're going very frequently, if it's in association with urgency or you have to run to the bathroom, where you can't make it to the restroom in time and you're leaking for that, then I would see a urologist so you can have a full workup to determine the cause. It's important to make sure that you're emptying your bladder adequately, and we have tests in the office that we can determine that. We always usually start with a urinalysis to make sure that it's not related to an infection, that there's no blood in your urine, that you're not spilling glucose from a condition like diabetes that could be leading to this frequency. And there's some other rare causes that we check for too, to see what the underlying cause is. So blood in your urine is always an issue that you need to seek urologic care for. It doesn't matter if it was a small amount of blood or if you're taking anticoagulation, if it only happened one time. It could be a symptom of a much more dangerous problem, and we're really trained to look for the cause and treat it if needed. I would say issues regarding pain also require urologic follow-up. So if you have a history of kidney stones and you're having flank or abdominal pain, if you're having pain with urination, if you're having testicular pain, all those things we can address. And finally, if you're getting recurrent urinary tract infections, I see a lot of patients with that, and they're treated through their primary care provider, usually well, but if you're getting multiple urinary tract infections, especially multiple times throughout the year, it's helpful to see a urologist because we can determine if there's an anatomic or a functional cause to the UTIs and help treat that as well.